one of the things I want to bring up with you, because I believe here I'm seeing you're one of the first practitioners training in California for psilocybin for medical use.
Hmm.
That
Hmm.
idea of fractals, patterns, taking yourself out into something new and opening consciousness and hopefully finding therapeutic use in it all. A controversial thing for sure, the
Hmm.
use of these things, but I want to tap into your knowledge of how you see it being played out, because right now tons, even big pharma is looking at this ketamine, right? And all different
Yes.
types of psychotropic drugs that can help with PTSD, all these other things. But as someone who understands not just the chemical compositions of things and how they interact with the body, but the deeper energetic and spiritual interactions, you know, tell us a little bit about your thoughts of how you would use something like psilocybin within a
Hmm.
integrative approach to help someone.
Oh, I love this question. And I'll tell you why I, I really think psychedelic medicine has its place.
Hmm.
But like everything, I think it can go a dark path, the wrong path if we don't use it right. And again, with consciousness, with high
Mm.
consciousness. So I love talking about it because I do think in with the right values and ethics and highly conscious use of it, it can be incredibly healing for people. It's just, and not for everybody, right? So but I love talking about it because it's not just a black and white
Yeah.
discussion to start. So, I did do this training. It was combined with Therasil, which is it's this Canadian nonprofit. And they get exemptions for people with like serious chronic illness, stage 4 cancer, serious, just untreatable depression to do psilocybin.
Mm.
And they're training practitioners. They're doing it in just a very highly ethical, really valuable way. So they came down here to California for the first time this past November with someone from MAPS together to do this training. So I right away, even though it's not legal here, I right away went to it because I'd really like to be part of the process of moving this forward. And I'll tell you, it made me think a lot about the ethics, the value. I think a couple things. I think that medicine is so powerful. It's really easy for someone to think, oh, the practitioner's doing all the work. But truly, it's just like with meditation, it's really the
Yeah.
inner person. They're doing their own inner healing work. They're their own healing teacher. So, being a real container of support if you're doing kind of guided work with someone in psilocybin. And it's so interesting because I've had so many patients in California that who've done psychedelics. I've gotten so much information on their experience with doing it with a friend or with a shamanic person and what went wrong, what didn't, where
Hmm.
boundaries were not healthy. So, so a couple things with psychedelics. I think one, it has to be in the right container with a really trusted guide that is coming, again, maybe just in heart math, heart coherence, most of it, and tuning into the person. It's not about them. It's about the person doing it. And the person doing it is going to be able to work on their own healing.
Hmm.
Um, I Where I do like psychedelics is I think they can show people a lot. And again, you can do this with meditation. Like as it dispenses retreat. I was next to some people who had epiphanies from, were meditating so many hours a day. Epiphanies they hadn't had in years about things they had to shift in their lives and about long-term emotional stuff. But you know what? A session with the right amount of psilocybin and the right atmosphere, the
Yeah.
right guide, everything, right set and setting, all of that could potentially, for someone who just can't get into that state of really tuning into themselves because they're in so much trauma and so much fear, or they're so sick, say they have like a really severe stage 4 cancer and there's so much pain, can be very, very supportive, showing them the work they need to do and giving them a lot of guidance. I mean, it really opens up the visionary center of the body.
Mm.
I've looked at people after psilocybin on one of my machines, and it
Hmm.
really just without them doing a ton of meditation. Not that you shouldn't work on doing daily practices to help yourself, just like completely opened up their upper chakras, their fourth, fifth,
Yeah.
sixth, seventh. But the question is that what do you do with that after?
Yes.
And I think it's really important that people have proper integration. And sometimes that's with therapy, but honestly, sometimes the kind of machines you and I work with can help them integrate it in their body. Holotropic breath work can help you integrate
Yeah.
daily meditation, things to really say, okay, this medicine's showing me this, but here's what I need to work on. And sometimes people just need to feel once in their lives that sense of pure unity and oneness and beauty, especially if they're been just told they're going to die of cancer in 6 months. And to latch on to that is a remembrance for what they can do with whatever they have left of their lives, or maybe they'll live even longer now because they have a sense of purpose and unity. So there are beautiful things with it. I'm not, the synthetic form. I've talked to people who've done it with psilocybin, at least that they're working on. It's going to be big, of course, a big business.
Mhm.
It comes on fast and then it goes away fast. Whereas, the pure mushroom version tends to have like a longer delay after, where you can potentially do more therapeutic work. So, I like natural. I'll say this: they're probably going to push the more synthetic psilocybin for the medical use. It still has its purposes. I will say though that mushrooms grow everywhere. I mean, psilocybin is in over 160 kinds of mushrooms. They were here before us. They're all over, so I think people will have access. But um, I do think there's use for that. Um, you know, ketamine is synthetic, but
Mhm.
it it you know, there are people who just cannot get off their antidepressants and they desperately want to. Their brain is so wired from the medication they're on over decades.
Yeah.
And I have seen ketamine help certain people get off their medications, but you have to be careful. Ketamine can actually be addictive. So
Yep.
there's uses for all. And MDMA, the studies of PTSD are pretty impressive. But I guess my point is there's some incredible uses for it, but there's also that concern that this is just a moment in time. If someone takes something, it may show them something or help them connect to a purpose or oneness, or show them something you need to work on. But what do you do after that? Are you getting the
Yes.
right support and what they call integration after? Are you going to do that work or not? You still have to do your work. You still have to do
Absolutely.
your work. So, all right. I mean, we each have to do our own individual emotional and, mind, body, spiritual work, which is a lifetime of work in this form.
Right. It's not a silver bullet. And, hearing you speak brought up two things for me that I've noticed with a lot of therapeutic options that are out there. Number one, it has to be done in the right environment. If it's
Yeah.
not really, and this even goes to like a lot of medicine in general, isn't done in the right environment. I'm sorry, like a hospital brings up a stressful situation, like flickering fluorescent lights, very clinical and dark, like, not a good energy and everything. And yeah, you can manage disease and maybe not die because of it, but it's not fostering a healing
Mhm.
experience. And you need the right people, of course, in a healing environment in general. But number two, even bigger, and this goes with almost every therapy, is you have to set an intention with it. The
Yes.
intention
Yes.
itself is part of it. It's like when you talk to people like the biocharger guys or a lot of these therapies that work on frequencies, energies, and everything, they're like, you need to ask the patient to set an intention within the field that
Yes.
propagates it.
Absolutely.
If you just go in skeptical, not caring, or your intention is just to get high or, feel really
Right.
good right away,
Or
that
escape. Escape is a
or
great one.
escapism, right? Yeah, or
Right.
escape, like, the symptom itself. That shouldn't be your intention. Your intention is to, raise your conscious, your
Yeah.
body into a very healing state so that it could self-heal itself, not to just escape
Yeah.
a symptom of pain, which is showing you something. It's a
Yeah.
calling sign, right? So that intention is actually really, really important. And I think whether you're doing it with psilocybin or anything, if anyone's listening and just, I think everyone has to approach their healing journey with a serious intention and purpose.